Your pharmacy plays a critical role on your healthcare team, and your pharmacist is one of the most important members of that team. So how can you ensure that you get the greatest benefit possible from your pharmacy when it comes to managing your health? Joining us for a discussion this morning is Jim Farmer, president of America's Best Care Plus, and pharmacist Teresa Jackson. Good morning to both of you.
Good morning, Olga.
I'm so glad we're talking about this because, you know, I feel like nowadays I'm just a patient going to pick up my pills and nobody cares about me anymore, Jim.
Oh, I know. You have to take ownership as a patient of your health care, definitely.
And I know you guys are making a difference in kind of creating that personal relationship. And before we talk about that, Teresa, there are many questions as patients that we should be asking before we pick up the medications. And I want to share some with our viewers. So let's look at the first one. This one's huge. Money-wise, of course.
Sure.
Is there a generic version?
Right. It's important to know that and ask for that when you go to the pharmacy, because many times patients don't think to ask about that. And the pharmacist can help you with that information as to whether there is a generic available or not. Also, if there is a generic available, it's going to be the same active ingredient. So although it may look differently as far as the shape and the size and the color, the active ingredient is the same. Another thing to know is most insurance companies will require generic substitution if it is available.
Let's look at another one that's great to ask. Are there any major side effects or special instructions? Very, very important.
Very important. It's very important to know what you're taking and how to avoid some of the side effects. Your doctor may go over those with you, and the information that you get from the pharmacist, the monograph, it has a lot of information, but it can be overwhelming. And so the pharmacist can help you weed through that and help you to know what you need to know.
And this one is imperative. What if I miss a dose?
Right.
For example, if you're taking blood pressure, that's important.
It is very important. And it does happen occasionally for whatever reason. It's important to know what you need to do. And the pharmacist is a great resource for that, to tell you what you need to do in that situation.
Now, Jim, as the president of a mail order pharmacy, how is this technology and your company making a difference to kind of bridge that gap that I feel is lost between patient and pharmacist today?
So many patients now are looking to online or mail order pharmacies because it's more convenient. And in many cases, we're talking about patients and caregivers who live in the rural areas. I grew up in a small farming town. And, there weren't a lot of resources around necessarily.
So getting to a pharmacy is almost impossible.
In many cases, that's true, yes. And so it's imperative that we're able to offer a service. Now, my mother died at 48 from complications with COPD.
I'm so sorry.
So it's something we're very passionate about in caring for our patients. If my mother had had better access, perhaps she'd still be around now. But, again, one of those drivers for my passion for making sure we take care of our patients.
And one of the problems also, if I may tell you, is adherence, like having a patient stick to the medication and remember to take it. So how do you help?
Okay, that's a great question. And we assign a patient care team member to each one of our patients and caregivers.
Oh.
So these care team members will reach out to our patients on a monthly basis.
And remind them.
And remind them and make sure they're doing okay, because that's important.
And it is important because let me show you this stat and let me share it with my viewers. According to pharma.org, 2 million Americans use 3 or more medicines daily, with 75% of adults that are non-adherent in one or more ways, meaning they're not sticking to the medication. This economic impact of non-adherence is costing the U.S. $100 billion annually. Now, that's amazing. So you're helping prevent that.
If you can't manage your medications, you're not going to live a healthy, full life. So we help in that regard, and by reaching out to that patient, like I mentioned earlier, and making sure they have all that they need as far as their Medicare.
Even information on the medication, the knowledge that they need to know?
Absolutely. Our patients ask questions of us that they ordinarily wouldn't take the time to ask their pharmacist locally because we have a relationship.
And Teresa, if I may ask, as a pharmacist for the company, it's very personal. It almost becomes like a family.
Well, sure, yeah. Some of these patients look forward to that call each month, and then sometimes they'll want to speak to me or one of the other pharmacists, and a lot of times they just need us to listen to what they have to say. They're not really asking for any information they don't already know. They just need to know that someone cares.
And how can we trust if we're getting our prescription from a reputable company? Because that's really important.
It is important, and so it's so vital that our patients and caregivers research their pharmacy providers. When you're dealing with mail order or online pharmacies, you have to do your research. Make sure that pharmacy is established. Make sure that they have the appropriate state licensure. Make sure that they're, if needed, in a Medicare beneficiary's case, make sure that they're certified by Medicare. But also make sure they're accredited. America's Best Care Plus is accredited by 2 accrediting bodies in the country. One is ACHC, which is a general health care accrediting body, and the other is PCAB, which is a compounding pharmacy accrediting body. Only 2% of pharmacies in the country are accredited by that agency, and we're one of those. So, you know, it's important to vet those pharmacies. Look, there's other research you can do as well. You want to look to see if those pharmacies have been the target of legal activity. It's very important. Also, if you get a phone call from a pharmacy soliciting your business, are they being super aggressive? That's not what you want. If they're being super aggressive trying to secure an order versus taking care of you as their customer, as their patient, then you probably need to look for another provider.
Thank you so much for your time. I do appreciate it. Jim, thank you very much as well.
Thank you so much, Olga.
And if you'd like to learn more information about America's Best Care Plus, go to americasbestcareplus.com. That's americasbestcareplus.com, or visit our website, thebalancingact.com.